These are the 7 most painful dental conditions ever. After watching this, you'll be scared shitless about your next trip to the dentist. Number 7. Dental abscess. A dental abscess is an infection inside the tooth or the gums that's filled with pus. If not treated properly, it has the potential to turn deadly. While there are a few different types of abscesses, they generally all have similar symptoms. The pain involved with an abscess usually starts off mild, but can quickly become extremely painful. The pain has been described as a throbbing or shooting sensation. The area in question will also swell up and turn red. In more extreme cases, the abscesses may spread to the bones and tissue near the teeth, which could cause swelling in the face or lymph glands on the neck. The pain will then spread to the side of the face near the toothache. If a severe abscess were to go untreated, it could eventually spread internally to tissues and muscles near the infected area. This spread can lead to a dangerous condition known as Ludwig's angina, or an infection occurring on the floor of the mouth. This disease can be deadly as it often restricts necessary airways. In fact, the name angina is derived from the Greek word ankon, meaning strangling. In addition to feelings of being strangled, the face, neck, and head will also become infected. It is even possible for people to die from an abscess. Famous fashion designer and notorious Nazi supporter Hugo Boss died from a tooth abscess in 1948. A 12-year-old boy named Diamante Driver died from a tooth abscess as well when it spread to his brain. Despite 2 operations and 6 weeks in the hospital, his life could not be saved. The same thing happened in 2011 to 24-year-old Kyle Willis when the infection spread to his brain and caused it to swell. In the cases of both Driver and Willis, a delay in treatment was due to the fact that neither of them had health insurance. Number 6. Periodontal gum disease. Periodontal gum disease is a result when gingivitis goes untreated. It appears as inflammation and infection around the tooth, and when severe enough, can cause tooth loss and damage to your bone structure. Once your gums are infected, they begin pulling away from the tooth. This space allows bacteria to form underneath the gums. It'll then progress by badly damaging the bone structure under the gums, and usually results in teeth falling out or being removed if not treated properly. Symptoms of periodontal gum disease include sensitive teeth, bleeding gums, swollen gums, loose teeth, and painful chewing. It is often the result of smoking, hormonal changes, or a byproduct of other diseases such as diabetes or even AIDS. Number 5. Edentialism. Edentialism is a condition in which one is either completely or at least partially toothless. It affects an estimated 158 million people worldwide. As we all can suspect, losing one's teeth can be very problematic. Teeth serve many basic yet important functions such as chewing food, maintaining speech, and supporting your facial structure. Teeth also allow humans to break their food down in a manner that is more digestible through a process known as mastication. As a result, malnutrition is a very possible side effect, which may additionally have a domino effect. Weight loss, constipation, and arthritis have been known to occur as well. In the most extreme cases of edentialism, the condition has even been connected to more serious and sometimes life-threatening diseases such as Parkinson's disease, heart problems, and even cancer. Number 4. TMJ conditions. Temporomandibular joint dysfunction, or TMJ, describes a condition in which 3 important parts of the mouth experience pain: the muscles that move the jaw, the muscles of mastication, and the temporomandibular joints, which connect the mandible to the skull. If left untreated, TMJ conditions can be chronic and quite painful. Symptoms of TMJ include dizziness, loss of hearing, headaches, pain or pressure behind the eyes, pain in the jaws and teeth, and headaches, including migraines and myofascial pain. The jaw muscles may also become stiff, making it difficult to eat or speak. It's estimated that up to 30% of the adult population is affected by TMJ in some form or another. Number 3. Tooth decay. Tooth decay goes by many names, but cavities and dental caries are the most common. Regardless of how they're classified, tooth decay can have a harmful effect on humans. While they usually cause symptoms such as pain and difficulty chewing, they can also lead to many of the ailments we've already discussed, such as abscesses, periodontal diseases, and edentialism. More than 2 billion people worldwide are affected by tooth decay in some form, though it is far more common in developing countries where they often lack proper resources to treat the problem. Broadly speaking, tooth decay describes any activity that involves the breakdown of teeth due to the spread of bacteria. It can be brought on by a number of factors such as poor hygiene and poverty, as well as other medical conditions such as diabetes mellitus and Sjogren's syndrome. Although diabetes is a result of high blood pressure and Sjogren's is a result of increased white blood cells, both conditions lead to a decrease in the mouth's saliva production. This is dangerous due to the fact that saliva works to reduce the amount of acidic activity within the mouth. Thus, a decrease in saliva production leads to bacteria buildup and an increase in the likelihood of developing tooth decay. While bacteria and dietary sugars are also common culprits, they alone are usually not enough to cause it. Exposure to an acidic environment is what significantly increases the likelihood of someone experiencing tooth decay. Symptoms may initially be difficult to spot, but the effects become more obvious as the teeth decay more and more. The affected teeth will change colors, usually yellow or brown, and will also be sensitive to the touch. Pain and tenderness are quite common too. If not treated, the tooth could crumble and the bacteria may spread to the surrounding tissue. This has the potential to lead to blood clots in the brain or Ludwig's angina, which, as we've already mentioned, is a very life-threatening ailment. Number 2. Burning mouth syndrome. Known as BMS, burning mouth syndrome describes a condition where there is a burning or tingling sensation within the mouth without an apparent cause. While medical experts are not exactly sure what causes it, they've floated several different theories around. The first is that it's related to menopause, as many of those suffering from BMS are postmenopausal women. Others believe it may be the result of an autoimmune disease, but there are still no statistical correlations to back either claim. Additionally, some hypothesize that BMS is the result of a psychiatric condition, as there exists a connection between BMS and depression and anxiety. Number 1. Oral cancer. Oral cancer describes any cancerous tissue within the mouth. The vast majority of oral cancer cases are classified as squamous cell sarcomas, a type of cancer that originates in the mouth tissue but can spread to the digestive tracts and lungs. In 2013, over 130,000 people died from oral cancer in the United States alone. Most cases of oral cancer are the result of human behavior, such as tobacco use, poor dental hygiene, malnutrition, and poorly fitted dentures. The most common symptoms include small, pale-colored ulcers as well as lumps on the mouth, tongue, inside the mouth, or behind the teeth. While these ulcers are usually painless at first, they often become more and more painful as the cancer progresses. One afflicted with oral cancer will also have trouble swallowing and moving their tongue. They'll also develop painful mouth sores and a sensation known as paraesthesia, a tickling or tingling feeling inside the mouth or face. Oral cancer is, in fact, the most common type of cancer in India, with about 130,000 people being diagnosed each and every year. Its prevalence stems from the high rates of tobacco use, including snuff, quid, gutka, and misir. There also exists common practices such as chewing on the leaves of paan, betel, and areca, all of which are known to cause oral cancer. Find out more about deadly medical conditions by subscribing to They Will Kill You. And to view more of our videos, visit theywillkillyou.com by clicking on the link in the top right corner of your screen.